Cutlery use. Setup. Find a comfortable and well-lit space. Make sure you are sitting at a table at an appropriate height. Have your feet on the floor and keep your back straight. Make sure you have your area and equipment prepared and laid out. Steps for parents. 1. Take the fork in your non-dominant hand and the knife in your dominant hand. If this doesn't work for your child, swap hands and find what works best. 2. To grasp the fork, point your pointing finger down the back of the fork, making sure to place the pad of the finger at the heel of the fork. The prongs should be pointing down. Take the knife in your dominant hand, pointing your finger down the smooth side of the blade. Place the pad of your pointing finger halfway down the knife. 4. Using the fork, stab the food, keeping the food in one spot. Take your time, cutting one piece at a time. 5. Place the knife parallel to the back of the prongs of the fork. 6. Move the knife forward and backwards in a sawing motion to cut the food to the size you need. Do this with slow and controlled strokes. To remove the food from the fork, use your knife to hold the food in place and pull the fork out. Using your fork, stab the piece you have cut off and dig in. Tips for teaching. 3 C's of communication. Clarity, conciseness and consistency. Provide the same, clear, short instructions each time to avoid any confusion and create a structured, stepwise approach in your child's head. Little and often. Remember, your child may not learn all steps in one go. Encouraging short, regular practice and teaching sessions over a longer time frame may be beneficial. Affirm success and encourage effortful attempts. Celebrate each step completed as a success and provide praise for effort and not just end result. Be patient. Give your child enough time to process, attempt, succeed and fail, potentially giving several lessons before completing all steps. Grading. As your child masters the skill over time, think about carrying out the task in more difficult scenarios, such as in a busier environment. Practical tips. Ensure correct finger placement when using knife and fork. If you place your pointing finger too far back, your cutlery will be hard to control, and too far forward, your fingers will end up in your dinner. In the beginning, trial the use of a single piece of cutlery. Begin by using a spoon, then trial the use of a fork, then the use of a knife, and finally trial the use of both fork and knife simultaneously. Ensure appropriate setup. Place plate directly in front of the child. Place the fork on the non-dominant side of the plate and the knife on the dominant side of the plate. Start by cutting one item at a time. In the early stages, cutting food items individually on a side plate may be preferable. Practice in a less pressurized situation, such as outside of mealtime. Practice knife and fork skills using Play-Doh or foods such as a banana. Adaptive equipment such as a spike board, non-slip sheeting and thicker handled cutlery may be used.